Hello everyone, welcome to the new series of Drishti IAS. I am Ritu and today we are going to discuss very important topic which is tuberculosis in India, and this topic is important from GS3 which is science and technology. So do you know that there are 1.3 million in people who died because of tuberculosis in whole world? And before moving to such discussion, first of all we will briefly discuss about tuberculosis. So what is this tuberculosis? So tuberculosis is an infectious disease which generally affects your lung area, and it generally transmits through air via cough, sneezing and spit. So this is a brief about tuberculosis. And what is the bacteria which is responsible for tuberculosis? So it is Mycobacterium. So moving to the points of discussion part. So first of all we are going to discuss the news, and then we are going to discuss mortality in India, and then we are going to discuss how many people get TB in India and what is the coverage of TB in India, and India's TB elimination target practice question for prelims and mains. So moving to the news part. So recently World Health Organization has released a report on tuberculosis, and in that report we will focus on India's stance, that what is the condition of tuberculosis in India. So this is the report and we are going to discuss about this report. So what this report primarily says about? So the report primarily says about that there is a two kinds of improvement in India's tuberculosis area and India tuberculosis cases. That first, its coverage has been increased, and second, that its diagnostics has been increased. It means that whatever the coverage we have regarding tuberculosis area or regarding tuberculosis disease, its coverage and its reporting has been increased. And the second thing is diagnostic. It means that many people now know that how many people are affected because of the TB. Earlier so many people died and they don't know the reason that why they have died and why so many people are dying. So now we are able to know the reasons that's why so many people are dying. So because of these two factors, this report is very much important, and there are other highlights also which we will discuss in the next slide. So moving to the next slide. Next slide is about mortality in India. So because of tuberculosis so many people are dying. So first of all we will discuss that what is the mortality stance of India. So a sudden drop in mortality due to TB was noted in 2023 report. It means that whatever we have reported in 2022, right now we have sudden decline in the mortality rate due to the TB. And with the change in data sheet, India's TB mortality dropped from 4.9 lakh to 3.31 lakh in 2022. So what we can see that here the cases were so much high, 4.94, it means 5 lakh, and right now we have 3.31 lakh. So is this the actual data, and is there any problem why earlier there was so much of 5 lakhs data and right now we have nearly 3.31 lakh data? So it's just because of the calculation method also. Earlier they used to take inspiration and evidence from the World Disease Report, but right now they are taking the samples from the sample registration system of India. It means that they are taking the primary data and they are using the primary resources which are very accurate in nature. So that's why we can see the gap here, that earlier it was 4.94 lakhs and right now it is 3.31 lakhs. So what we have seen that there is a more accurate coverage of data because of this WHO 2023 report. And what are the other highlight of this report? That there is a reduction in India's contribution, and earlier it was contribution of 36% and right now we have contribution of 26% in 2022. So we can see that there is a 10% of reduction in case of the tuberculosis, which is a very good sign for a country. So moving towards another slide. Another slide is about how many people get TB in India. So here they are talking about the actual data, that how many lakhs and crores people are affected because of the TB. So nearly 2.82 lakh people got TB in India in 2022. So here we are not talking about the overall TB cases in India. Here we are talking about the registered cases in 2022. And what is the registered cases in 2022? It is 2.82 lakh. And what happens after that? It means that after every 11 seconds in India, people get infected because of the TB, which is a very worrisome situation for a country, that after every 11 seconds, every people is infected by the TB. And India's contribution to the global burden is 27%. So it means that whatever the contribution and whatever the data we are showing in case of the TB, India alone contribute 27%, which is very huge in number, and especially the country like India who has the largest population and also who is the population who are suffering from the malnutrition, stunting and wasting kind of the issue. So this is a very worrisome situation for a country, and the global TB report 2023 shows that reporting of the cases has improved in India, going beyond the pre-pandemic levels. It means that it has been improved from pre-pandemic levels, but when we see that overall data, it is very huge in number, which is 27% alone, which is very huge and which is very worrisome for a country. And this is despite the fact that India along with the Indonesia and Philippines accounted 67% decline in the TB cases. Despite of this decline, we have this much of contribution. It means 27% of the contribution. And what is the reported cases right now we have? So earlier it was 24.2 lakh cases in 2022, and right now we have 24.04 lakh cases in 2019. So we have improved. So here you can see that, from 2019 2022 there was a minimal changes, but what happened that right now the cases has been reported a lot, but earlier the cases has been reported very less. So that's why there is a minimal differences between 2019 data and 2022 data. So because of that also we can see that increased number of the cases, and this global burden has also increased. So moving towards the next slide is about coverage of TB treatment in India. So we already had discussed that there are two highlights of this report, that coverage has been increased and also diagnostics has been increased. So what is the coverage stance of India? So the report acknowledged that increase in the coverage, and 19% increase can be seen from this report, that earlier whatever the reporting happened in the case of tuberculosis, right now this time 19% people have been reported the case. It means that more number of the reported of cases, you will record more number of the cases. So maybe the actual stance and actual condition of tuberculosis has been improved, but because of the more number of reporting cases, the more data we can see and the more numbers we can see by the sufferers of tuberculosis. And globally, the report notes that treatment coverage in 2022 reached to the pre-pandemic levels of 70%. It means that whatever the treatments we have earlier, right now 70% people are getting benefited from all those treatment. It means that our treatment coverage has also increased. The reporting coverage has also increased and the treatment coverage has also increased. So this is a very good sign. Moving to the next slide. Next slide is about India's TB elimination targets. So the United Nations has fixed the targets of 2030, but India has fixed the target of 2025. That by 2025 they will eliminate tuberculosis from this country. And what is their minute target, we will discuss in this slide. That National Strategic Plan of 2017-2025, and what their plan under this, that no more than 44 new TB cases per lakh population. It means that by 2025 they will have only 44 cases per lakh of the population. And other reports they have that only 77 cases they should have by 2023. But what is the stance of today's India, that they are getting 199 TB patient per lakh population. So they should have 77 patient per lakh population, but right now we have 199 per lakh population. It means we have to also improve in this area, and this is also challenging for us, that in 2 years how we will improve this kind of the target and how we will able to achieve this kind of the target. So this is also a worrisome for us, that from 199 how we are able to reach 77, and by 2025 we have to reach 44. So from 199 we have to reach by 44 in 2 years. So this is also problematic situation for the country, and they have to also take care of various deaths also. So right now, what is the death stances of India? So the program aims to reduce the mortality by 3 deaths per lakh. So right now we have not this kind of data, and whatever the things we can see that we are getting so many people whose mortality rate is very high. So the mortality rate has been decreased, but we are not able to achieve by 3 deaths per lakh population. So we have to also take care of in this area also. Moving to the next slide. Next slide is about that. This is the data we have, that what is the stance of India throughout the years. So this data belong to 2020, and this is 2022, and this is 2023. So we can see the improvement and whatever the demotion we have in the case of tuberculosis. So what is the estimated TB cases? So in 2020 we have 26.4 lakh, and in 2022 we have 29.6 lakh and 2023 we have 28.2 lakh. So what we can see that there is a decrease of 1 lakh TB patients, and it's because of the government's efforts and it's because of the awareness among people regarding the tuberculosis. Coming to the percentage of global burden, so right now we have 27% of the global burden and earlier we have 28%. So in 1 year we have decreased by 1%. So this is a very slow growth in terms of the tuberculosis, but we have a positive trend in this regard. Coming to the mortality, so earlier in 2020 we have 4.36 lakh, right now we have 3.31 lakh. So we have improved a lot in this area. From 4.94 lakh we have come to this 3.31 lakh, which is very good signs. Coming to the percentage of global deaths, so in 2020 we have 36% and 2022 also we have 36%. Right now we have 26%. So what we have seen that in these 2 years there is no improvement cases, but suddenly we have improved by 10%, which is also a positive trend in terms of the tuberculosis cases. Coming to the drug resistant TB, so earlier the cases were 1.16 lakh, then it become higher also 1.1 lakh, and now it is 1.110 lakh. So this area has seen a very minimal changes. And coming to the percentage of global drug resistant TB, so the percentage is 27%. So this is also we have increased in this area. So that's it for today's lecture. Coming to the question part, so here we have discussed a question which is 𝐃𝐞𝐤𝐬𝐡𝐭𝐢 portal is related to, and you already know the answer, and your options are dengue, TB, malaria, COVID-19. So you have to answer in the comment section. Moving to the mains part, which is the highlight of this today's class, and the mains question is highlight the interplay between malnutrition and tuberculosis mortality in the Indian context. Here they are asking the Indian context, and we already had discussed so much of data. And show how does malnutrition contribute to the susceptibility of the individuals to tuberculosis, and how does TB further exacerbate malnutrition. So here you have to show the correlation between malnutrition and tuberculosis. So in the background you will write that what is the correlation between malnutrition and tuberculosis, that you know how they are correlation with each other, and if people are malnourished, there are high chances that they will get TB, and if TB patient have this weakness kind of issue, and if they have malnutrition kind of issue, there are high chances that they will die, and the morbidity rate is high among those kind of the patient. So these kind of the correlation you can see, and you can show into this kind of the answer. And then coming to that, what is the percentage of India in mortality rate? So we have discussed that it was 27%, and overall burden, global burden is also 27%, and around 3.31 lakh people are dying. So we can see that this data is so much high, and being a populous country, being a developing country, and being a young populous country, our mortality rate is so much high and our burden is also so much high. So you have to show correlation here that it's because of the malnutrition, and we accept that we have so much young population but they are malnourished, and because of that their immune system is very weak, they have this oxygen kind of issue, they become anaerobic, and because of that they are getting so much of this kind of diseases. So we need to work into this area, and we have to also show the plan of the government regarding this area, and you have to also write that India has taken place that they will eliminate TB by 2025, and they had also launched plan like TB Mukt Bharat. They had also launched portal like 𝐃𝐞𝐤𝐬𝐡𝐭𝐢 portal and so many other helpline numbers. We have also developed so many drug resistance program, also so many what you can say treatments for these kinds of the tuberculosis patient. Our coverage has been increased. We have increased by 70% of coverage. It means that around 70% of the people who are suffering from tuberculosis are getting treatment, which is a very good sign for India. So you have to also discuss government plan regarding this, and then in the conclusion you have to write that this is a tough situation for India, that being a populous country, as 27% of the population, and we are the 27% burden on the global in terms of the TB, but there are chances to improve, and we are reducing in terms of the tuberculosis cases. So we have to also work on the positive side of the tuberculosis, and we have to positively think into this direction, and we have to take care of the government, that what government is taking initiative along with us. So you have to also make awareness regarding tuberculosis, that it is an infectious disease. If any person of your family is getting this kind of the problem, you have to follow so much of precautions, just like the COVID-19. So I hope you like this lecture. If you have any queries related to this lecture, kindly ask in the comment section. Thank you.